Healthy teeth in your mouth stimulate the jawbone through daily activities such as eating and chewing. When it is necessary to remove a tooth and it is not replaced, the bone at the site and the adjacent teeth are at greater risk for bone loss. This can make later tooth restoration difficult. As oral and maxillofacial surgeons, we are highly trained and experienced in advanced bone grafting techniques to achieve optimal, long-term results. Socket preservation is performed after a tooth is extracted to restore a single tooth site to prepare the area for dental implants. Socket preservation consists of bottled bone and a collagen membrane to hold it in place. A sinus lift procedure may be necessary in the back of the upper jaw to augment the bone thickness for successful implant placement. Bone grafting can also be performed to fill in low or thinning sections of the jaw in preparation for a full arch restoration. These proven techniques have allowed many patients who were once told that they are not candidates for dental implants to successfully restore missing teeth. During your consultation, our team will evaluate your oral health and work with you to develop a treatment plan to restore your oral health and smile.